Now to a problem that we've been seeing since the start of the vaccination rollout, racial disparities in vaccine distribution.
And now a new report finds out just how stark those disparities are and proposes a solution going forward. TANEISHA CORDELL live this morning with the report from the Center for Community Solutions. Good morning, TANEISHA.
Yes, good morning.
Good morning. It's Friday. Hello.
It is Friday, okay? We're getting to it. I'm going to hold off because I know where you're headed, okay? We got more important things to focus on right now. This report showing nearly 1.5 million Ohioans have already been vaccinated so far, and still Black people here in Cuyahoga County are underrepresented. We're learning they're much less likely to get the vaccine compared to white residents.
While Black people make up about 28% of the population, they've only received about 11% of the vaccines.
LOREN and ANTHES co-authored the new report, finding disparity exists in the Latinx community as well. They make up 5% of the population, receiving just over 1% of vaccines.
Some of this has to deal with access, supply chain issues, just general coordination.
But there are solutions, one being federally qualified health centers like the Neighborhood Family Practice.
They are well equipped to reach vulnerable populations, and they serve a higher proportion of Black and Latinx patients in the county.
NFP President and CEO Gene POLSTER says they spotted disparities early on.
When we've opened up registration to the broader community, it's generally folks who are white and more educated that have access to the technology.
So they started targeting minority communities specifically and holding events like a vaccination clinic at local churches.
Many of our elderly patients that we had done outreach, we had been unsuccessful in getting them to come into the clinic for a shot, early vaccine hesitancy. But when their church reached out, they were there.
We heard that same sentiment from Pastor PHILLIPS last week. He and POLSTER both say early hesitancy about the safety of the vaccine has passed.
We've seen now an outcry in our people from being hesitant to take the vaccine to when can I get the vaccine?
Now, POLSTER says healthcare centers just like hers are more than equipped to handle these vaccinations. They specialize in primary care, so they know all about these routine vaccinations. They just need more doses, just like many other providers, in order to carry out their outreach. Katie, Danita.